Deborah Criddle here with Mortgage Queen. I have conned Kimball Arritt into coming and visiting with me today, and he's got a new procedure in his office that we just want everybody out there to be aware of. So he is a chiropractor. I don't know all your credentials. There's lots of alphabet letters after your name, but give us a little bit about your credentials.
So I'm a chiropractor. I focus in family practice, but I also do a lot with sports medicine and sports chiropractic. I am an internationally certified chiropractic sports physician, which we get into the acronym, but basically just means that I'm certified and I get invited to go to international sporting events and treat athletes with a group called FIX, Federation of International Sports Chiropractors. We go to the World Games, the CSIC Games, international water skiing, Muay Thai, just lots of different federations.
So you've gone to multiple countries. What are the countries you've been to?
So I've been to Spain, I've been to Italy twice, Greece, and then in 2022, the World Games were actually in Birmingham, Alabama.
Alabama. I guess that's all right. So you keep athletes able to go and compete, but now you've added this other step to your practice, which is going to help people with neuropathy.
So 2016 or thereabouts, plus or minus a year, insurance companies got together and decided that neuropathy is no longer, or they're not going to consider it a medically necessary condition any longer, which means that they're only going to do maintenance care, so things to manage it, gabapentin, pop a pill, and wellness and health don't come from pills.
No, they just mask it and create more damage to other organs in some cases.
Lots more damage. If you look at some of the new studies coming out about gabapentin and Neurontin and some of the others, they're originally designed as anticonvulsants, so they literally shut the brain down. And so some of the new research coming out is showing that the risk of Alzheimer's with those types of medications goes up by as much as 85%. Your risk of cognitive decline in 10 years is really high. They're not sure what percentage to put on it, but they're seeing that there's a significant or statistically significant cognitive decline within 10 years.
So you have somebody who deals with neuropathy, that nerve pain, that stuff that's just debilitating to people. And the fix in the normal medical world is to pop this pill, but now you have this procedure that is going to fix the pain rather than mask the pain. So can you give us a high level review of what that looks like?
Yeah, so when you're talking neuropathy, there's the three main causes that are, we'll call them hidden causes because medicine doesn't talk about them too much, but it's typically blood sugar. That's unregulated blood sugar. You don't even have diabetes for that to be a problem. Just if your blood sugar's high consistently, you're going to have issues. Next one's going to be systemic or inflammation. So chronic inflammation in the body is going to break down the ability of your regenerative capabilities in the body. And then the last one is going to be circulation, right? So the more blood sugar issues you're going to have, the more inflammation you're going to have, the more circulation problems you're going to have. And then what happens is those capillaries that feed the nerves, they start to break down, and then that protective sheath around the nerve is called myelin. It starts to break down, exposing the nerve itself, and then it starts to misfire or degenerate itself, die off, not function. And then you get that stocking glove progression where your fingers and toes start to go numb, you start to lose balance, and it just progresses upwards.
Oh my goodness. So to the point, I don't know a lot about neuropathy, but obviously the pain is there. But then it goes into the point that you just can't use that limb.
If it goes complete sensory loss, then you end up needing to have bracers and different things. But neuropathy can have lots of different symptoms. It can be as little as numbness and tingling or a loss of sensation. It can be burning pain at night or in the daytime. It can be pins and needles when you apply pressure. It just depends on how the nerve is being attacked, how it's trying to regenerate, and the source.
So the traditional thing is here, pop this pill, then your brain shuts off its ability to know that there is a problem. Exactly. So your pain goes away because your brain says it's not in pain anymore.
It enables your body's ability to ignore the problem.
Okay. So from there, you're just letting this pain go up the extremity further and further and do more damage because the brain doesn't know it's doing more damage.
Exactly.
So your procedure comes in. How long does it usually take on average with somebody kind of in the middle? You've probably got this brand new case to this extreme, somewhere in the middle. What kind of a time frame for fixing this? Or
everybody's a little bit different because it depends on where they're at on the loss of function scale. Typically, someone that has been diagnosed with neuropathy has already been suffering with it for 7 to 10 years.
So, do you think they even know they're in pain anymore? Because they've got so used to being in pain, they don't even know.
They change their set point for sure. So when they start to lose function or they start to lose balance, that's when they start to say, now this is a problem.
Something's wrong.
Right. And so you got to restore that. So it can take a long time. This is more of a marathon, less of a sprint. This has been going on, like we said, by the time it's been diagnosed, we've got 7 to 10 years of damage.
And not one
And
time with you is not going to
one
fix
time
it.
is not going to fix it. But the beautiful
Yeah.
thing is a lot of the protocols that we're instilling, these are at home protocols, things that you can do at home that we ask you and you have to do at home. We're going to have you go on a dietary change. We're going to use nitric oxide. So we're going to boost capillary flow, restore blood flow, basically. Some really awesome studies about nitric oxide and how it boosts the function of the vascular system and opens up those capillaries. Because when you're talking neuropathy, in the body, we have 60,000 to 100,000 miles of blood vessels, right? Less than 1% of those are the size of a pencil as far as thickness. So as long as your heart's going, it's not a problem. Is the blood coming through? It's the highways open. Are the exits, are they closed or not? Can we get blood into the capillaries, to the nerves, to the tissues? And when we got that neuropathy, those exits are closed. And so we got a nitric oxide to boost those capillaries. We're going to do photobiomodulation with red light therapy to open those up and stimulate blood flow, allow those capillaries to open up even more and get into tissues like nerves that are the end of the line, so to speak. And then we're also going to do nerve retraining with electric stimulation from a rebuilder to stimulate proper firing patterns in those nerves.
Do you think that there's a point that you have somebody who's had this problem for 5 to 7 years and they've just been pounded with medications? Is there a turn time of having that medication out of your system so that your body understands there is a problem again? Or is that even something that we have to worry about turning back on?
That's a multifaceted question because we're not, in my profession, we're not going to ever recommend, we can't recommend that you stop taking medication. But what we have seen is that as you start to change your nutrition and you start to get nitric oxide, stimulate that vascular system, you get the photobiomodulation, and then you get the retraining of the nerves, that the need for the medication, that anticonvulsant, goes down. And so typically people will start to have their doctors recommend, oh, you're getting better. That medication must have worked. It has nothing to do with the medication, right?
Your secret's safe with us.
A friend of mine had this program with a gal that had 100% sensory loss. Basically, you could have said to her, hey, look over there. She'd have looked and you could have smashed her foot like Mr. Deeds with a hammer. She wouldn't have known.
Oh.
Right? And she was able to achieve in about 10 and a half months, 80 to 90% restoration of her functional capacity in doing this. But she'd been on gabapentin for 9 years and had never gotten better. So what is 9 years and one day going to do, right? It's not going to change it. What those medications are doing is trying to calm your brain down and help you ignore the problem because they've given up on you, right? And a lot of times when we see people with neuropathy, the common refrain is, well, there's nothing we can do for you. Here's a pill to manage it, right? And that's the common refrain from patients is, man, they keep giving me a different pill. Oh, well, that one didn't work, so maybe this one will work.
The newest and latest that came out last week for. So aside from neuropathy, this protocol that you've got in place, is there other things that it's helping, or is this just strictly like a neuropathy, different levels of the neuropathy situation?
This new one, particularly, we're just focusing on neuropathy, but we can do vasodilation with nitric oxide supplementation. We can try and relieve some pain, obviously, because you want that to go away, and that'll help as well. But the protocol, as we've instilled it, is particularly for neuropathy. We've got some other protocols we've brought on for metabolic syndrome and helping people to get rid of chronic fatigue and help them with weight loss and help them balance their hormones by regulating the gut, right? Getting rid of that leaky gut problem. And sometimes in a lot of those cases, actually, we have to combine both of those protocols because typically if you've gone long enough with that anticonvulsant or with neuropathy, it typically started somewhere, and most of the time it started in the gut with the breakdown of the gut lining and more inflammation coming from there, rather than get our chronic inflammation that gets into the extremities. That gut lining breakdown now will affect your body's ability to process sugars, which now leads you to become a type 2 diabetic, right? And 50% of type 2 diabetics are going to experience or have experienced some amount of nerve or neuropathy symptoms.
So in the time frame that you've had this protocol, you haven't had it for very long?
No, I have not had it for very long.
But highly skilled in it because of the knowledge that you've got and the amount of time that you've focused on learning this and the importance of it. Yeah. Have you had a success story yet? Or are you in the middle of success stories at this point?
Right now we're in the middle of success stories. We've got people that are just starting out. I'm excited to see the progress that they're making, and we'll have some stuff coming out about patients who started here and have gotten to there. But right now we've just started doing this about a month and a half ago. So when you're looking at most patients start to see results at 90 days, but max benefits or the bigger benefits happen usually somewhere between 6, 12, or 18 months.
So you got to be patient.
Like I said, it's a marathon.
It is. And I think the big thing that everybody has to realize is, in a roundabout way, this has to fall a little bit more into the natural medicine concept of, you take a gabapentin or you take a Tylenol, it takes care of the problem pretty quickly. When you're talking more of a natural medicine or fixing the problem, it's not an overnight thing. And so you have to anticipate 3 to 12 months before you really, and you can't give up. You have to stay with it.
It takes time and dedication, just the same way that most of these people and patients got into the problem. It took time and dedication to continuing to do all the things that led to the degeneration. You got to put that same time and dedication into fixing the problem. And medications help a little bit, right? They're going to help mask those symptoms. We talked about Tylenol. You smash your thumb, you're glad to have the ibuprofen, so to speak. But if you broke a bone in there, you're going to need the cast, and you're going to need to do something to allow that bone to heal and not just keep smashing it.
And that's actually a really good analogy if you think about that. Because you're talking about these capillaries shutting off and these nerves having issues with blood flow and all of that. Well, if you break a bone, you're not just going to be like, well, I hope it fixes itself, fix the problem.
Yeah, we actively fix the problem.
So why wouldn't you be actively looking to fix something that's a little bit inside your soul? It's inside you more. So
and not only is it inside you, but it's robbing function from you, right?
Is.
This is robbing people's ability to balance problems start to become really problematic. If you lose your balance, if you lose the ability to move around, then you have to become sedentary, right? Yeah. They've told us for years, sitting is the new smoking. Except for neuropathy is combining the new smoking with no mobility, and it's just going to get worse. And so you have to be willing to put forth the effort to make the change. This is definitely one of those things that a lot of it can be done from home. So it's beautiful in that way, right? The photobiomodulation, the rebuilder therapy, and the nutrition, that's all done from home. And we combine that with chiropractic aspects to help that nervous system function better and to take pressure off the spine and to take pressure off the extremities and to improve blood flow. And all of that coalesces to a really awesome opportunity for healing. But most of it, you'll be in the office and we'll treat you. You might be there for 10, 15 minutes for your treatment, and that's awesome. But then you're outside of the office for 24/7. So it should make sense, hopefully, to people that I got to do something at home. I got to make these changes, because if you want it to work, you have to put in the effort to allow it to work.
Yeah, it's just like anything with weight loss, with any type of thing. You have to take it all in. You have to do it all. It's not a pop a pill situation.
It's not, but the beautiful part of that is it puts you in the driver's seat. It gives you control of where a lot of these patients have felt like they've lost control, right? They now live tied to this pill or tied to the medication or tied to the problem. Now they've got the vehicle to get their life back. And so a lot of them are grabbing hold of it because they've experienced the loss that's hard to fathom, right? And so they're ready and willing to make the change, and they see great success with the research studies that we share with all of our patients if they want them. This protocol for neuropathy, it's over 90% successful in restoring function.
Jeez, that's huge. That's just a huge statistic to be excited about. It really is.
Yeah.
I think the greatest thing about your practice is I came in contact with you a few years ago, and in most thought processes of chiropractors, you go in, you do your bone cracking, and you're out the door. Yeah. But in your process, it is training your body to go back to where it was supposed to be in the first place before your posture suffered, or the way you sit all day, or the lack of your exercise. It's helping to put your body back. And now you've implemented this alternative fix. Really isn't a chiropractic thing, but just makes you that better of a chiropractor. Because there's just so much. The human body is a whole circle. And so you can't fix the heart without fixing this, and you can't fix the brain without fixing that. It all goes in together. So good on you for learning that kind of stuff.
We all know it. It comes down to educating the patient, right? We want to make sure that our patient knows that there's more than just being thrown on a table, getting the adjustment, because the adjustment feels great. But research also shows that after one adjustment, your body's going to go back to habit within 48 hours.
Oh, yeah, right? Those muscles are strong.
And so it comes down to being willing to educate the patient. And I love my profession, but a lot of times we're not wanting to fight that education, because you get the Z-Pack and you just take it and then you're supposed to be better. And it's not knocking my profession. Dentists do the same thing. You look at teaching patients how to arrest tooth decay. You can arrest tooth decay, but how many patients are going to arrest the tooth decay? And is it just easier to fill the cavity, drill it out? Same thing, a lot of doctors, you can arrest the degeneration, but a lot of people just looking for that momentary pain relief. And
quick fix.
And there's practices that do that, and there's a place for that. If that's what you're looking for, I don't knock it, right? But We want to address the causes in my practice. We want to fix the problem and give you a real solution that's going to last, right? We always talk about our destination wellness in the office, right? It's a journey to get there. It doesn't just happen in one step. We've got to take the steps. You got to walk that path and then get to that destination wellness. And then once you're there, you got to stay there, right? So,
well, and you're the greatest thing because you've spent so much time with my husband, and you have some tough patients that aren't just go in there and crack them. And I do know that you are willing to pull out the books and find those one-off things that you probably learned at some point, but you don't see it every day, but you know that it's there. And so you're not above, is that the right word? You're not above pulling out the books and just, man, I got to be able to help this patient. I know there's something here and this isn't working. And if it takes you 5 different routes to get a solution, that's what you specialize in, which is huge for your
and that's
field.
actually the birth of bringing these protocols on, is because as the American diet continues to get worse and as people take more and more medications, I've been in practice for over a decade now, and I see that things that worked really well 10 years ago, they seem to not have the same effect now. Is that because care is not as good? No, it's because we've got more trauma. We've got more toxins in the system. We have to do something else. And so getting into the research, well, what can I do? How can I help my patients more? How can I help more people? And that's where all this came from, is I want to help more and I want to change people's lives more. You don't always get to go to the World Games and work with elite athletes where one adjustment and they're just back out on the field and happy-go-lucky, right? You get somebody that comes in that's got sciatic pain or they've got other issues that take a little bit more time and understanding, and we've got to get to the root cause of that problem. And a lot of times, especially with what's going on, it's chiropractic care, it's adjustments with changing what's going on physiologically with the patient.
I sprained my ankle. And it was just weird. I was walking down the stairs and I was the 3rd stair from the bottom and my ankle just completely gave out. Mm-hmm. And I was just devastated because I walk fast. I'm a go person. And when I came over to your office and said, help me, I assumed that I would be hobbling along for a couple of weeks at least. And no, I got this. And you did some stuff that made some tears come to my eyes. It was I went back to the moment of, I think I could give birth and it would be better than what's going on right now. But when I got off that table, I walked and it was tender. I wasn't going to go run on it.
Well, it was still damaged, right?
Yes, but the fact that I could just walk on it and you gave, these are the things you've got to do and see you in 2 days. And it was just awesome. So I think you are definitely a diamond in the rough for what is out there in this market. So to sort of add this protocol to it and help those people that just feel like my popping on my pills is my end all. That's all I got.
I want to change that. There are better options out there, right? And it's going to take a little bit of time, but just like with your ankle, it's going to take some time, and there's going to be moments where maybe some therapies or different things cause you to use my name as your new favorite curse word, and I'm okay with that. But we're going to get you feeling better, and we're going to get you moving better. To have that ability to move, that's life. And the minute you stop moving, that's the end of life.
There's only so much Netflix you can watch before it's just like, I'd rather go take a walk. All right, well, anything else you'd like us to know before we wrap this up?
No, I think that covers a lot. There's other topics we can cover at other times, but for now, that's a good cover.
Well, I'm going to add his information on how you contact him at the end of this video. And I'm a huge advocate for Dr. Arritt. So if you have anybody who needs to sing his praises, I'm your girl. And I appreciate all you do. And I'm excited. We'll regroup in a year from now. You'll have success stories. It's not even a question. It's
going to be great. Yeah. I look forward to having success stories like my friend and seeing these people regain function and go back and enjoy life and
tears of joy.
Be able to buy fancy shoes, pretty shoes again, because they don't have to wear their bracers.
All right. Well, Mortgage Queen, Dr. Kimball, Arritt, have a good day.
See ya.
All right, go be an adult. Don't be afraid of it. Nobody taught us this stuff. We're all just learning the hard way. That's why this matters. Share it, and when you're ready, come find me, Mortgage Queen.